Let's get recording. And before we go any further today, we want to start with a land acknowledgement. We gather today in many places, but our team here locally in King County is in the ancestral lands of the first people of Seattle, the Duwamish people, and we honor with gratitude the land itself and the Duwamish tribe and all the Native people who call King County home. We know that in addition to the Duwamish, King County is home to the traditional lands of the Muckleshoot, Snoqualmie, Tulalip tribes, and other Coast Salish people. And as well, today is blessed to be home to a vibrant and diverse community of Indigenous people from across North America and beyond. I'm going to launch some polls now. If you'd like to let us know how you are feeling and how you are feeling about our spring weather, please feel free to do so. We also welcome you to introduce yourself in the chat with your name and organization as we just talk through some of our meeting norms for the next hour. First of all, kids, pets, and sweats are okay. Nothing too formal or fancy expected. Take care of yourself. Snacks and drinks are welcome. Take a break if you need one. We do love to see your faces and welcome you to be on camera if you would like, but feel free to stay off camera as well if you're more comfortable that way or your bandwidth requires it. And we're going to be doing our best to monitor the chats here on Zoom and Whova, as well as pausing to invite spoken questions. So we'd love to be interacting with you in those ways throughout our presentation today. When we go into a more dialogue focused part of our workshop, we'll talk a little bit more about some ground rules, but in general, ask that you respect the experiences and perspectives that others share. I'm just going to take a quick little look at the poll. See, many folks are feeling good and loving the sunshine. Yes, we've had some awesome sunshiny weather recently. Today, where I am, maybe not so much. I'm going to leave that poll open for just another minute, and I'll be speaking over to my colleague. Honey?
Thanks, Sarah J. So yeah, what influences sort of health and well-being? And so we're hoping that throughout this presentation, we'll cover some elements related to socioeconomic factors such as education, and family support, income. We all know that those are sort of socioeconomic factors, physical environment, sort of where you're living, health behaviors such as tobacco use, diet and exercise, alcohol use, are all sort of what we consider health behaviors. And lastly, healthcare, sort of access to care and of course quality to care. And we know that all of these are sort of important, and it's important to note that policies, equity and justice, and programs all impact an individual's experience and access to these resources. So we'll be covering a sort of a variety of topics today, but really wanted to ground us in some of those factors that are greatly impacting people's lives. Next slide, please. And so I think it's again really important for us to understand that oppressive systems and racism continue to create disparities in access to services, in education, economic attainment, and life expectancies for communities of color here in King County and really throughout the nation. In 2020, we know that COVID-19 has really exacerbated and intensified this by putting a spotlight and highlighting how communities of color are disproportionately impacted by COVID-19, and we'll really get into that a little bit later in the presentation, all while sort of further driving these underlining disparities even more and really perpetuating them even more. And we also note that communities of color experience higher rates of sort of underlying health conditions that are due to sort of this lack of access to really high quality healthcare. And so again, this presentation will highlight 4 different sort of snapshots across the lifespan so we'll sort of start at like infant mortality. We'll then go into education attainment, housing, and life expectancy. And then we'll really relate those to then policies that impact each and every one of those, whether it be discrimination, systemic racism, and access to resources that don't necessarily occur in isolated moments, but rather occur dynamically, right? And often simultaneously throughout an entire lifespan across many, many generations. And so that'll be sort of what we're covering today. And then I will hand it over to my colleague, Vanessa.
Thank you, Hani. So once again, Vanessa Quinn, social research scientist. And I think before we go into talking about the data, we want to just take some time to think about, take a step and think about the role of data, exactly how it's been used to negatively towards communities, and the role and the relationship between data collection and their policies. So thinking about how we collect data, one of the things that we hear a lot from our partners is that current data and how we capture race and ethnicity doesn't necessarily reflect the communities that are within King County. But the Office of Management and Budget, they defined race and ethnicity as 5 distinct categories. So American Indian, Alaska Native, Native, Hawaiian, Pacific Islander, Black, Hispanic, and white. And as I've said, this doesn't necessarily reflect the variety of diverse racial and ethnic groups throughout King County, but throughout the country at large. And these aggregate racial and ethnic categories, they provide an inaccurate reality of how people see themselves and how others are seen each and every day as they move throughout our community. So we see this conversation as like one of many iterative steps in thinking about how we might think about data being more equitable. So policies impact data collection, and then data impacts policies. It's a constant feedback loop going back and forth. And what we want, right, and what we strive for is to have community engagement in each and every step, to being able to inform policies, but then also informing how we collect data moving forward. Community engagement, translation and interpretation, and outreach are all important parts of this cycle. And by translation, we're not just saying going from English to Spanish or any of the other commonly spoken languages in King County. It's about making sure that they're culturally appropriate and making sure that they reflect how communities speak and communicate with one another. Next slide, please. So once again, we see this as part of this like iterative process and talking about data. So if we think of like data collection, data analysis, data dissemination, and then we have on the outer circle, thinking about translation and interpretation, thinking about the policies, practices, thinking about the programs that some of you all are engaging in within the community, and then making sure that we're focusing on equity and social justice. And the center of that circle is community voice and engagement. We are continuously trying to engage with community members and talk to them about how we can use data for equity. So thinking about what does data sovereignty look like, who owns the data, and how does owning the data, how might that translate to data equity, data justice, and examples of that include culturally adapted surveys and tools, and centering community voice and knowledge. We know that there's already a lot of expertise in our community, and making sure that we center that as a way to continue this conversation. And we believe in APDE that data equity should be incorporated in funding, motivation, data collection, sourcing, analysis. So trying to incorporate equity in each and every part of the way. This is not to say that we're perfect. We understand that there are some limitations, but we keep on striving for that each and every step of the way. Next slide, please. So with that being said, what have we done up until this point? Like I said, this is a constant, like iterative process. So to date, some of the examples of steps that we're taking, one is that our team is providing technical assistance for a community-led data collection project to highlight community stories. So basically, one of the things that we hear is government owning data and not necessarily telling the stories of the communities and not necessarily reflecting the experiences of those communities. So part of this project is allowing communities to collect their own data and to tell the stories in their own way, and we're providing assistance as it relates to the needs of those communities. Whenever we can collect and share data that is disaggregated by more specific racial and ethnic identities, that's what we try to do. So there are two examples of that. So first, the Best Start for Kids health survey. So we've disaggregated the data for Native Hawaiian, Pacific Islander, Asian, Black, and Latinx. So examples would include Samoan, including a category for that, including category for Ethiopian, Cambodian, and Mexican. So just going more into depth into these like racial and ethnic categories to better understand the experiences of different members of the community. We also have disaggregated data in the Healthy Youth Survey, particularly the Asian categories, because we know within the Asian ethnic groups, there's differences and disparities, and keeping it as one category masks the different disparities that different groups will face, and doesn't necessarily inform how we might be tailoring services differently to members of those communities. We also understand that quantitative data is just one step of the process, right? So one of the things that we're trying to do as well is trying to incorporate more qualitative data collection. So one example is a youth and young adult gun violence report where we collected qualitative information through focus groups and key informant interviews about issues pertaining to gun violence. And then the LGBTQ Spotlight Report. So each year we release the community, the CHNA, so the Community Health, I forget what the NA stands for, sorry. But it's this large like quantitative study, and the LGBTQ Spotlight kind of like hones in on this specific group and trying to understand some of their needs within the community. I think it's the Community Health Needs Assessment. There it is, got it. And then we do deep dives. So deep dives, basically, we have quantitative data and then talking to community members and seeing like, does this data actually reflect the experiences that you're having, and kind of ground truthing it in those communities. And lastly, it's also about like making sure that we're adding new data fields and data elements to capture things that aren't necessarily being captured. So one of the most recent things that we've been working on is we added a question about racial discrimination to a statewide behavioral risk factor and surveillance system. So once again, this is just part of this like constantly iterating process. We've done these things. It's like a first step, and we're continuing to try to achieve data equity each and every step of the way. And I will pass it on to Sarah J.
Thank you, Vanessa. Before we go any further, I want to share our secret code word for those of you participating in the Best Starts for Kids Summit Build, Rise, and Soar Challenge, which is renewal. So I'm going to go ahead and drop that word into our Zoom chat and ask if one of my co-presenters who has access to the Whova chat right now could add that as well. I'm going to open another poll, if I could figure out how to move on to our next poll. We are just curious as we move forward into talking a little bit more about data to hear from you how you use data in your work. So I think that poll should be open. And yeah, let us know. You should be able to choose more than one answer. And just to give a little bit of an overview of how we're moving forward, we've spent some time talking about like some of the big pictures of how our team is thinking about the intersections of equity, racism as a public health crisis and data. Next, we're going to be taking a look at a few specific pieces of data, of which there are many, many out there that really demonstrate racism as a public health crisis. And we just picked a few that we know the health department looked at when making that formal declaration last year that show different windows and, you know, just different aspects of the systems that people interact with and the course of their lifetime. So I'm going to keep this polling up and to start talking a little bit about infant mortality and just start with what do we see in this data specifically for King County. Babies born to American Indian and Alaska Native and Black mothers are over twice as likely to die in their first year of life as the King County average. So for every 1,000 babies that are born in King County, about 4 overall for the county do not survive their first year of life. But for every 1,000 Black babies born in King County, that number is double, it's over 8. And for every 1,000 American Indian Alaska Native babies, it's even higher at 13.4. When you think about the impact of a loss like that on a family and community of a little one, it's hard to even really imagine what the impact of these numbers is in terms of how it's felt by the community. It's pretty unacceptable inequity that we see there. So when we think about infant mortality, what does this capture? So many things go into infant mortality that it's often considered like if you just want to look at 1 or 2 markers of well-being in a community, it's going to be infant mortality. But we know that it's linked to stress that accumulates for women of color from generational and lifetime experiences of racial discrimination and systematic oppression. These inequities all take a toll on the body and create biological changes that affect the health of mothers, newborns, and infants. So there's many things that go into infant mortality that are impacted by racism. Things like nutrition, substance use, socioeconomic factors like education and income. But studies have shown that even these factors, which in and of themselves are racialized in our society, they cannot fully explain the inequities that we see in the birth outcomes. So just in and of themselves, racial discrimination and stress are a contributor to these inequities that we see. And how does policy impact the outcomes that we see in the data? Many policies impact those many factors that lead into infant mortality, but an example of just a couple include access to health care, like high quality prenatal and perinatal care, as well as paid family leave to care for newborns. I'm going to pass it off now to my colleague Joey to talk about the next piece of data we're going to look at, educational attainment.
Thanks, Sarah J. So we know that educational attainment is tied to economic stability. And as you can see here on this slide, the chart that we're presenting represents adults with less than a bachelor's degree for those ages 25 and over by race and ethnicity. And you can see that the solid line represents the King County average and the dotted line represents the white rate for adults. And the wealth and resource gap between many students of color and white students in King County is tied to inequities related to educational opportunities and resources. It's also important for data and future research to understand the complex relationship of socio-historical and political forces that shape the experiences and opportunities for Native Hawaiian Pacific Islander and American Indian and Alaska Native populations, as well as engage these groups, as well as other communities of color in planning and developing opportunities that will support educational attainment in culturally mindful ways. Next slide, Sarah J. So in terms of highlighting just a couple causes and policies that are related to educational attainment, we know that racial and ethnic gaps in educational attainment are directly associated with systemic inequities in neighborhood funding, as well as discrimination that impacts academic supports and resources. So for example, from a national and state level analysis on revenues based on racial and socioeconomic characteristics, school districts with a majority of students of color receive $23 billion less in education funding than predominantly white school districts. From a local analysis in South King County, we also know that for the same infraction, Black students are over 1.5 times as likely than white students to receive exclusionary punishment. So that represents 46% of white students compared to 71% of Black students, signaling that race is a major factor in discipline. This also creates ripple effects since students who are suspended or expelled have disruptions in learning, so are at a greater risk to fail courses. It also leaves students with a weaker sense of belonging than their white peers and leads to further disengagement, all of which impacts future education and career opportunities. When local Black high school students have described their ideal school in order to succeed, they voiced that key priorities would be teachers who can identify with students and understand where they are coming from, create an environment that values autonomy and emphasizes learning where differences are celebrated and schools tailored to students, a school that prepares them for life beyond high school where students are involved in creating and shaping what that looks like, and culturally relevant lessons and history. Next slide, please. So in summary, when we're thinking about educational attainment, which we know we are just providing a really quick overview of many of these different topic areas before we talk more about the role of data in our discussion, we know that communities of color across King County are more than 1.6 times as likely not to have a bachelor's degree compared to white students, and access to child and parental support, healthcare and social resources, things like transportation, food, and technology, as well as school district funding and systemic discrimination, all impacts a student and family's ability to attain educational success and further their academic career as well. And we also know that throughout COVID-19, there's been existing stressors or barriers that have really been heightened, including variance in remote or in-person learning, a school district's funding, which can impact the ability for proper ventilation or access to PPE, as well as internet and technology, again, which can impact the ability to have that necessary to support and adequate engagement in schooling environments. Mariko, I will hand it off to you for the next topic.
Thanks so much, Joey. And so housing stability is another really important factor for health and well-being, and a key part of that is housing affordability. So these data that are on the slide now are one indicator of housing, and that is housing cost burden. So housing cost burden is when a household pays more than 30% of their income on housing. And what this graph shows are the rates of housing cost burden among different race and ethnicities in King County. And then what we also see are two lines here. So the dotted line represents the rate among white individuals, and then this solid line represents the rate among the county as a whole. And what we're seeing is that households of color are far more likely to be cost burdened by housing than white residents, and some groups experience that more than others. For example, Black households are more likely to experience housing cost burden than any other race or ethnic group in King County. And it's important to know when looking at these data that these disparities have long-rooted causes in policies related to things such as lending practices, wealth accumulation, access to resources. And so while this is one indicator, we see local disparities in other areas, such as homeownership rates among whites is twice that of Black residents in King County. And even locally, kind of down the housing pipeline, Black adults are evicted at 5.5 times more often than, and Latinx adults are evicted twice as often as white adults in King County. So there's some really substantial barriers to accessing affordable and stable housing here in the county. Next slide, please. And so really what's important are the contexts around these disparities. And there are many contributors to them, but many of the big ones can be traced back to redlining and other racist real estate practices that were practiced nationally, but importantly in King County and Seattle. And so certain areas were defined as being ideal for banks to invest in some mortgages. And these policies combined with what were called racial restrictive covenants prohibited people of color from buying, renting, or living in certain neighborhoods for decades. And we see those lasting ramifications even to the present day. Other policies include that for decades, zoners, and this has exacerbated disparities and in wealth, and has also contributed to our current affordable housing crisis. And then just even to the current day, inequities in access to houses, condos, and apartments still takes place through the practices in credit ratings, lenders, and also real estate industry too. Next slide, please. Oh, I think I may have gotten frozen or, okay, thank you. I'm seeing the next slide. So overall, this is the importance of housing. It's stable, safe, and affordable is an important part of well-being. But over generations, barriers to homeownership has led to really extreme wealth gaps by race, and it's reduced the financial security and housing stability for many communities of color. Additionally, divestment in segregated neighborhood can lead to communities of color to have less access to resources and services than white communities, which further exacerbates disparities. And then also lack of affordable housing and evictions can put people in a cycle of housing instability. So for example, evictions and homelessness can really go hand in hand. And it's been shown that evictions can reinforce poverty by making it increasingly difficult for an individual to find stable, affordable housing after an eviction notice. So really that these are not the result of kind of individuals, but really as a result of a culmination of a lot of policies and practices over decades. And I'm going to hand it off back to Vanessa.
Thank you, Mariko. So given the stressors that people of color experience throughout their lives, what does that mean for life expectancy? So what we have here is the life expectancy for the average King County resident from 2012 to 2016. So the dark black line is the King County average, and then the dotted line is going to be white residents. So as you can see here, the average life expectancy of the King County resident is 81 years old, and that's pretty comparable to the life expectancy of the average white resident. And I think one thing that I want to do is just like not just focus on like a deficit-based approach. As we can see, Asian and Hispanic communities, they live on average longer than the average King County resident. So you have Asians have a life expectancy that's about 4 years higher than the average King County resident, and Hispanic residents have a life expectancy that's about 2 years higher. So I think one of that lends itself to how can we collect data to understand how are these communities still able to thrive and live longer despite some of the stressors that they're constantly facing and constantly experiencing throughout their lives. However, while we do have Asian and Hispanic communities that are tend to live longer, the same doesn't hold true for Black, Native Hawaiian Pacific Islander, and American Indian Alaska Native. So you have Black residents that have a life expectancy of 77, Native Hawaiian Pacific Islanders 73, and then American Indian Alaska Native at 72. Next slide, please. So I think the main takeaway is that the chronic stress that accumulates over a lifetime for BIPOC individuals results from a generational and lifetime experiences of racial discrimination. Sarah J started off the conversation with infant mortality. So this road kind of shows from infancy all the way to life expectancy and seeing all of these different points at which communities of color are experiencing disparities and how that maps onto how long they live and how long they're able to continue to engage with others in their community. And we want to move from like this individual level of analysis. So government sanctioned policies and practices, including education, home ownership, and employment, have created an environment that hinders upward mobility for a lot of communities. And these pervasive and daily systemic disadvantages disproportionately impacts the health, social, mental well-being for BIPOC communities, and ultimately just takes a toll on the body. And I will pass it on to Hani.
Thanks, Vanessa. So before we get into this, I just want us to take a moment and recognize that we are still, in the times of COVID-19, and whether you were or have been directly impacted by this through your individual experience or through some of the work that you are doing with community. I just want us to take a moment, just, recognize that and recognize that it's been almost a little over a year and that we still got some work to do and some time ahead of us. And I'm just hoping that we all sort of take care of one another. We check in on one another, and we remember that this isn't something. This is something that's impacting us, right? It's something that's impacting us every single day. So I just want us to take a moment and recognize that before we get into the data side of that. So when we're talking about sort of COVID-19 cases, many communities of color are experiencing higher positive COVID-19 cases compared to the overall rate here in King County, right? And so this chart shows the percent of cases, which is in the blue, compared to the King County population, which is in the gray. And so Black, Hispanic, Latinx, Native Hawaiian, Pacific Islander and American Indian Alaska Natives communities all have higher percentage of cases compared to their percent compared to their percent of the King County population, while white residents in King County have the lowest percent of cases compared to their specific percentage of the King County population. Furthermore, something that we should definitely acknowledge is that people of color are more likely to be sort of essential workers, more likely than white workers to have filed unemployment claims within their industries, which is most impacted by COVID-19. And of course, this coupled with the prevalence of underlying health conditions put these communities at a much higher risk, which are the reasons why we're seeing the numbers here in front of us. Next slide, please. So on this slide, you'll see that the gray bar represents the population estimates, with the blue bar again representing the current number of vaccinated residents. And we're seeing this sort of broken down by age. And so we see 16 and up, we'll see 65 and up, and we'll see 75 and up from left to right. And much like the COVID-19 cases, we're seeing a very similar trend here in the vaccine distribution, and that communities of color are indeed again experiencing a much lower rate. And so when we think about the why, when we think about sort of why is this happening, there are unfortunately systems and structures that are put into place that continue to perpetuate this and that make this a reality for many of our communities, whether it be this first come first serve basis, which we know that there's a lot associated with that, like having access to different types of technologies in order to set up those appointments, whether it be your access or sort of where you're living or your zip code that determines if you have access to these sites, or if you're able to get to and from those sites. Are you able to take time off of work? And so these are all really important factors that determine, again, whether someone is able to receive the vaccine or not. We also understand that there's a lot of hesitancy. While there's this push for vaccine, there's also a need to just recognize, again, the historical trauma and the historical factors that are involved in why there is hesitancy in some of these communities and why people are a little weary, right? And it's important to make sure that we have those very strong connections with the public, between public and some of these experts, to make sure that some of those concerns are indeed addressed and in some cases even alleviated. And so next slide. So what needs to be done, right? And I touched on this a little bit already, but just really focusing on those that are impacted the most, right? And working with community, whether that be partnering with some community leaders, community elders, to ensure that some of those concerns and some of those questions are being addressed. Making registration easy, not making it a link, maybe thinking about how can we best do outreach in the most sustainable way. Making vaccine available when people are available, right? Addressing transportation and mobility. Are people able to get to and from these appointments? Ensuring language access. We know that there's a lot of opportunities out there. There's a lot of programs out there that make language access a little bit more easier, but really making sure that we're interacting and engaging with those access opportunities. And of course, vaccinations regardless of immigration status. So really ensuring that, again, health is for all. So I'll pass it over back to my colleagues again.
Thanks so much, Hani. So at this point, we are going to open it up for an opportunity for us to all engage a little bit with each other. And we have some discussion questions prepared, as well as a process for how we can all engage with each other. But before we do that, we wanted to propose some discussion guidelines. So first, we wanted to invite you to share your experience, but also allow space for others to contribute their own perspectives and experiences as well. So please do step up and also step back. And a reminder that intent is different than impact. So it's okay to disagree, but please hold yourself and others accountable for negative impacts. And then a reminder for self-care. So we've all, after this last almost year and a half, have been in many different Zoom meetings and have different stressors or distractions at home or wherever we're tuning in from today. So please do take that break, step away, take a breath, have a drink or a snack or whatever you need to take care of yourself and your body. And before I hand it over to Sarah J, who will describe our discussion and the process, we wanted to pause to see if there are any other guidelines that any of you all would like to suggest. And you're welcome to share that in the chat at this time or even come off of mute momentarily. All right, I am not seeing anything yet. Again, if you have anything else, feel free to put it in the chat, but Sarah J, I will hand it over to you.
Thank you, Joey. We have some discussion questions and we are experimenting a little bit. We really wanted, we saw a large number of folks adding us to your summit agendas, and we wanted to try to find some ways that would allow as many people as were interested to share their thoughts. So we're using something called Padlet. Before we ask for your input and thoughts and dialogue around these discussion questions, I'm going to take a quick moment to show it to you. So if you follow this link, which we'll be putting in the chat, it will take you to a page that should look like this. And that also has our same discussion questions here. And if you have a thought that you want to add, you can click the plus for the question that you think it's most responsive to. Feel free to just also add it if it's kind of like maybe not specific to one of these questions. And I am going to choose one. Let's see, how can data be used to address racism? One idea that pops into my mind: demonstrate / quantify extent of impacts to policymakers. We all know some policymakers and decision makers really feel like, show me the data. So that's one thing I can use. And then there you go. If you have links or anything that you'd like to share, you can also play around, upload a file, upload a link, upload an image. If you want to get creative, feel free to do so. But if you just want to add a text, go for it. If you see something someone else has said that really speaks to you, you can also hit the heart button as well. We can get an idea of, yeah, this is something that really spoke to a lot of people. So that's one option to engage. If using the Padlet isn't working for you, you can also add things into the chat, and we would also love to hear your voices as well. So let's start with the first question. How can we change the legacy of data being used against communities? And while you think about that, I'm just going to take a moment, check in on the chat, and see how this Padlet link is working for folks who are trying it out. I see that some folks are being able to add ideas. All right, so use Vanessa's link if you need a link. If you're having trouble using it, feel free to let us know that in the chat as well.
And also feel free to use the chat, multiple ways to try to get at these questions.
Yeah, we know this technology is new for us and for many of you as well. So we wanted to try to make it make multiple options available. If you find one that works, that's great. Sorry about that. Let me put this back down. Looks like a lot of folks are choosing to use the Padlet. Maybe let's just give a couple more minutes for thinking and writing, and then I might ask if one of my co-presenters would like to just go through and read aloud some of the comments that you all are sharing.
Just a quick note for folks as well. I'm seeing a lot of comments come through, and so also remember to kind of scroll down on your page. Mine's starting to get long, but there's some great stuff in here, and also too, I'm loving that people are engaging with it and putting some hearts on the comments that are resonating with them.
All right, there's so much going on here, and I'm just loving seeing it all. We've got about 10 minutes left of our time together, and we do have a little bit of wrap up um, resources and contact information for you. So I'd love to hear from my co-presenters, but maybe we can each just choose one or two items that we're reading on this Padlet to share aloud.
I can share one of the ones that I see right now on the how can we change the legacy of data being used against communities is to really highlight the beauty, strength, and resilience of communities alongside community needs, and that communities have many answers. So I thought that was a great one and a good reminder for all of us.
And one that I found, what does data justice look like? Somebody wrote, investing in data and evaluation, training, and professional development of BIPOC researchers. And that's something that resonates with me a lot as a Black woman who does research. So I thought that was like a really good point.
I'm going to read a couple that I see in the Zoom chat just to make sure that gets heard as well. The reason for the collection of data needs to be visible to those collecting and participating. Absolutely. Data questions are often skewed to represent answers desired, and bias in data collection is harmful.
I'm seeing here in our questions about what does data justice look like, a really kind of theme around, and I think this one comment, holding cultural rigor at the same priority as scientific rigor, kind of captures some of the comments in here about the need for valuing community knowledge and community experience, as well as the acceptance. I've seen another one, acceptance and acknowledgement of non-traditional academic data sources as well. So I think that really, I think there's a lot of really great insight here about what we would traditionally think of as far as our current data systems and some of those expectations of what is rigorous or valid, and how community-based knowledge and knowledge from I guess, for example, cultural rigors, it was called, was also something that's important to uphold and to center as well in our ways of knowing and understanding our community.
I think one that really stuck out to me, and sorry if this has already been mentioned, but how can data be used to address racism? It's disaggregating racial and ethnicity data to allow for intersectional identities. And we know how important that is. And I see that a lot definitely in my community. So thank you for sharing that.
I see another one, what does data justice look like, that has gotten a lot of heart reacts on it, valuing Indigenous ways of knowing. And I just want to shout out one of our partners who's an incredible local resource here, as well as nationally, which is the Urban Indian Health Institute. And they work with health data for urban Indigenous communities across the United States, but they're based here in Seattle, and they've been an amazing thought leader and support for us as a data team in the health department, and really talking through how do we indigenize data collection, data analysis, data sharing. They're just amazing.
And someone shared in the chat box a great resource on this topic that I'd like to share is Decolonizing Methodologies by Linda Tuhawai Smith, as a way to think about different methodologies around data collection. Thank you for sharing that.
We've
I
got
think
about
too, one thing that we can do is to pull together some of these comments on Padlet and share them out if folks are interested in that.
Yeah, this link, if you want to save it, should work. So it's something you can come back to if you would like. We have the slides from earlier in the session available through Whova as well. Just want to give a few minutes also to the participants if anybody wants to chime in on the chat or come off mute. If anybody has any wrap up thoughts that you want to share before we go ahead and get ready to close out the session. If not, we can go ahead and just want to make sure we share out some ways to follow up with us, provide further input, ask questions, get resources. You can find us online at communitiescount.org. We have a lot of data there. We have a lot of links to different sources of local data there. We have content from all the workshops that we do. And we will have, if you were interested in this discussion, it's the beginning of a series that we're planning in partnership with Communities of Opportunity. So you can sign up for our newsletter, Community Data News, by emailing us at communitiescount@kingcounty.org. Oh, that should be kingcounty.gov. I'm so sorry. So yeah, you can email us, or there's a link to join. We don't send out a lot of newsletters, so we're not going to spam you, but if you want to be sure to hear about future webinars, that's a great way to hear about them. And again, we really love to hear from you. If you are looking for support in working with your organization's data, if you are looking for data to use, whether it's for program planning or putting it into advocacy work that you're doing, putting it into grant writing that you're doing, we can help you out with that. So get in touch. We do check this inbox on a regular basis, so you will hear back from us if you ping us at communitiescount@kingcounty.gov, and we also welcome you to reach out to us individually as well if you prefer. Really want to just express gratitude to my co-presenters and to all of the participants who joined us today. I hope that this was interesting. I hope it was thought-provoking. I hope that it inspires you to, hold us in the health department and other institutions that you work with accountable for, doing our best to use data for equity. And really appreciate all of the thoughts that you shared in the Padlet and the chats, because I know those are going to really be a good source of inspiration and guidance to me as we move forward in this work.
Echoing the appreciation from Sarah J, and also too that we would love to take a lot of these comments from our Padlet discussion back to our colleagues and our teams as well at the Assessment Policy Development and Evaluation Unit. And also encourage you to check out communitiescount.org and stay in touch with us as well.
All right, well, thanks again, everyone. I am going to give it just one more minute if any one of my co-presenters wants to chime in, and if not, we will go ahead and end the Zoom, but welcome you to reach out to us here or on Whova if you want the slides, if you want the Padlet link, if you have any questions or looking for resources, we'd love to hear from you. So thanks again, everybody, and have a great rest of your afternoon.
Thank you, Sarah J, for facilitating and leading us through this. And we look forward to hearing from everybody either via email or hopefully at a future workshop. Have a wonderful day.